An elderly woman wearing barely a blanket moans, sleeps, and waits for hours near a frigid doorway. Around the corner, an elderly man is bleeding. He's being treated in the hallway by a nurse.
Right here, sore?
His son-in-law waits against a nearby wall. Down this hall, another patient desperately tries to rest in a busy, bright corridor after waiting more than 6 hours for treatment. It's just an average day in Leahy Clinic's Burlington emergency room.
We want patients to come to Leahy Clinic because of the emergency department, not despite of it.
Dr. Malcolm Creighton is in charge here. Mac has been advocating, sometimes even begging, for a bigger, better, more modern space for Leahy Clinic emergency patients for years.
We see about 36,000 or 37,000 visits a year in the emergency department here. If you put that up against a national benchmark of size, we're half the size we need to be for the care of that volume of patients. One of the things that we have is about a 38% admission rate. So in other words, if you come into my emergency department, there's a 38% chance that you'll get admitted to the hospital. That's one of the highest in the nation. It reflects the level of acuity, the level of complexity of the Leahy Clinic patients, and makes us relatively unique and presents some design challenges, some care challenges as well.
Fortunately, the care here is still great, and the outcomes are exceptional. But the patient experience can be downright awful. Ken Desilets has been in the hallway for the last 5 hours. It's certainly not helping his pain.
So you know when you're sick at home, you like quiet. You don't get quiet here. You get noises, you get bumps, you get doors opening, people running up the corridors. You just don't get quiet. So you want to be able to relax while you're being treated. And you can't do that here. Constant interruption, people banging into your bed and loud noises, and it's just extremely disruptive. But as my wife said, the care is the best, so we tolerate it.
Not everyone is so understanding.
One of the nurses mentioned you have a shortage of space here for some reason, and that's why he's out here. So, but still, I mean, I think he deserves better care than being out in the hallway.
Put you under the blanket so you're not chilly.
It just doesn't seem very private and very professional to me.
You know, we have some of the best patients here at Leahy, and our nurses and physicians are stellar, and we take great care of the patients. And unfortunately, we don't have the space we need to take care of them appropriately and to maintain their privacy. That means, you know, being able to care for them, evaluate for them in a space that's private and that's not out in the hallways and in public areas. And so we really do need some more space in order to make that happen so that we can maintain patients' dignity and to take care of them appropriately.
Certainly, overcrowding isn't unique to Leahy Clinic. Hospitals across the nation are dealing with this epidemic. But here at Leahy, we're simply behind the times. This place was built back in the early 1980s. Renovations since then have been few and far between.
I think I have a coffee mug in my office from 1995 when we did some uplifting or some renovation for the trauma program.
It's embarrassing to year after year have to continue to figure out ways to support this physical environment because it's suboptimal. We've been for a long time, for a number of years now, working hard to figure out strategies to improve the physical environment that our patients rightfully deserve, and we haven't really been successful. We need a major overhaul. We need to do something dramatic, transformational, and we're struggling to make that happen.
This much we know. ER overcrowding leads to higher costs for providers and patients alike. It also creates longer waits and increases the chances that the emergency room won't be able to deal with real emergencies when they happen. Here's our Leahy ER reality. In Burlington, we treat nearly 38,000 patients a year. This place was built to treat 18,000. We have 22 patient rooms. Given our numbers, we should have at least 30 rooms, plus the trauma suite. Add that up, and you have an emergency department stretched to its breaking point. That doesn't go unnoticed by patients, neighbors, and the communities we serve.
It's a little bit of a tight squeeze around here.
I try to do my best to promote Leahy when I'm out in public, and when people ask, oh, what do you do for work? I work at Leahy Clinic, and they say, oh, that place, it's a zoo. It's crazy. So usually when I'm out my normal life, I tell people, well, you get really good care. It doesn't matter what it looks like. We do have the equipment to take care of people correctly. It's just, I mean, it's old. A lot of it's old. And I mean, you have huge holes in walls. The toilets, again, are falling off the wall. Tile's gross. It's just it needs like a revamp.
All right, honey, I'm going to give you more pain medicine. Granted, you know, I think you can't build an ER big enough for all the patients we're always going to have, but you could definitely make this ER bigger. It's way too small. And I'd say that's the only drawback in this ER, because other than that, you have awesome doctors, awesome nurses, great patients, great family members. Everyone that comes in is usually very, very, very nice. It's just that the layout's kind of small.
Despite the physical limitations, the care delivered in the Leahy ER continues to be cutting edge.
I was getting my 2 girls ready for the day, and woke up with my 8-month-old at about 5:30 in the morning, and fed her, and my 2.5-year-old woke up at 7:15. So I got out of bed, quickly threw on some clothes, and brushed my teeth, because you don't always get a chance to do those things when you're running around with the kids. And I noticed I had a really hard time with my left hand getting the toothpaste out of the tube. And I remember thinking that was very funny. And next thing I know, I was on the floor, and I was having a hard time getting up. The paramedics came very quickly, and, you know, they were pretty clear with me in my bedroom saying, you know, you've had a stroke and we're going to get you to the hospital. And 10 minutes later, we were here at Leahy. And things moved pretty fast after that. I was talking to some of the doctors, and they told me that, you know, you've definitely had a stroke, and they confirmed it and said, we can enroll you in a clinical trial if you're willing. And we went through the documentation, and that seemed like a good idea to me. They put me under, and I woke up, and like magic, everything worked again. I mean, literally, I couldn't move my left side. I was having a hard time speaking, and came out of anesthesia and said, God, what time is it? I can honestly say that, you know, clearly this is the best possible outcome I would have ever expected. I mean, even stepping outside of my own experience, I would never in a million years think that somebody could have a stroke this young and that severe and walk out of it 3 days later as if nothing happened. I mean, I'm extremely grateful to Leahy. I had no idea that there was this kind of specialty here. I had no idea that there was such a great unit here, but I'm glad I was here, because I don't know what would have happened if I wasn't, but I know that I have a great result, and 4 weeks out, don't look like I've just had a stroke. I don't act like I just had a stroke. I don't walk, or, you know, I can pick up my daughters. I can smile and they see both sides of my face. I think Leahy's fantastic.
Don Garfield doesn't necessarily echo those sentiments. In fact, he thinks his father-in-law deserves better than what he's experiencing in the hallways of Leahy's emergency department.
The care has been okay. It's just the lag time and the wait has been the most difficult part, especially for him, because he was in a lot of pain when he first got here. And it took an hour and a half before he got any medication from the time he got here. So maybe closer to 2 hours, I don't know. It's been a long wait. And of course, there's no place for me to sit either. I mean, I have to stand here, and it sounds like I may have to wait for a couple more hours before he's even put in a room. So it's quite inconvenient, as you can see. So.
How does your foot feel now?
This gentleman came to me from minor for admission, so he'll wait here till there's an admission bed upstairs. And he's already been here probably like 3 hours, right? 3 or 4 hours.
Karen Hayward is this patient's nurse. And as hard as the overcrowding is on our patients and family members, it takes a toll on the staff too. They also believe Leahy patients deserve better.
Ralph is my patient in the far side hallway. Granted, he has his son-in-law here with him, and I have 4 other patients over there. He doesn't have a call light because he's in the hallway. He has a chart that's just put up there in the hallway, which anyone has access to because he doesn't really have his own spot. This happens a lot where the patients in the hallways don't have call bells. Most of the time don't even know who their nurses are because they see so many people running back and forth. And you always identify yourself as, I am your nurse, my name is Karen, but you know what, they never remember unless it's consistent and you see them all the time. In the hallway you don't feel safe because you have no call light and you just see mass confusion all over the place and their charts are everywhere.
My main concern, of course, is that he's comfortable and he's taken care of.
I feel like we really do need to improve our area here so that we can better take care of our Leahy patients.
We are a first-rate hospital. We do some spectacular things. We have some wonderfully talented people, and many, many, many patients over the years have benefited from the talented care they've received here. This, unfortunately, when they step into this environment, that's not the impression people get. They come in and, as a first impression, with a very different sense of what are they going to really experience here. And the importance of the emergency room as the front door to the hospital can't be understated.
Case in point, Suzanne Gilman. Suzanne was recently rushed to Leahy's ER following a bad car accident. Had she been conscious, she says she would have insisted on going to Boston. But what she experienced in the Leahy ER, she says, was nothing short of miraculous.
I was on familiar roads, driving at slow speeds, and my car caught in mud. And it veered off the road, flipped, rolled, hit a tree, hit the ground, rolled again. I don't remember falling, I don't remember landing, I don't remember anything else. And so apparently when the emergency crews came up to the accident scene, what the police who were on the scene told me the next day was they thought I was dead. They made the decision to come to Leahy rather than at least one other hospital that was closer, because they felt the level of care here was at Leahy was what I was going to need or potentially need. They did x-rays very rapidly to check primarily for brain, and they were a little afraid I'd fractured my pelvis. And those came back, they were okay. They started drawing blood, getting IVs in, and then they were starting to list what they wanted CAT scans of. And in the end, the list got so long, they just said head to knees. I was okay. 5 hours after I came in as a top-level trauma patient, I walked out. I walked out, admittedly, in a hospital gown because they'd cut my clothes off. But I walked out. 5 hours, that's nothing. The experience was so good and so just, I have comparison. I have other emergency rooms across the country, around the world that I've been in, and I know a superb team when I hear it. And I seek out the top in medical care. And I just felt that this was one of those experiences. It just, everything was right.
Thanks to the care Suzanne received from the trauma team at Leahy's ER, she now is moving all her care to Leahy Clinic.
Well, I think we're proud of the clinical care we give. Sometimes the ability to give the human side of the care is difficult. When a patient's in one bed and the next patient over is vomiting, or you feel bad for the patients. I think we enjoy the care we give, but not the environment that we give it in. Every emergency department that is within about a 20-mile radius has been renovated in the last 10 years or so. I think we're the last department that hasn't gotten an upgrade or a total renovation or a new emergency department. A lot of hospitals recognize that trying to retrofit an emergency department is almost impossible and have moved their ERs to a new location. And that's probably what we would need to do, rather than try and live through our current space or fix our current space, is really start from scratch.
So, what's the dream?
Really to have an emergency department that has the capacity to care for all the patients who show up in a very quick manner, so that they're recognized that we know they're here, they feel like they're the most important patient to us, and that we get and are able to address their problem right away.
This old drawing on the wall is a proposed design of a new Leahy Clinic ED. Well, it would have been new several years ago when Leahy last tried to modernize the department. Today it serves as a hopeful reminder.
When I interview candidates of bright young doctors who want to come work in an emergency department at Leahy Clinic, I say, unfortunately, I have to give you a tour. And so that's one of the things that they look at, and when they come, then they're comparing us to other places. They know that the physical environment here is challenging. They also know that we've taken a lot of false starts at it, and that we've almost built it a couple times. And I have to tell them, I really do think it's going to happen. And I think this time it will.